The Health Resources and Services Administration, or HRSA, has announced that it can no longer cover the cost of COVID testing or treatment claims for the uninsured. They say that the most recent COVID budget impasse in Congress is to blame. Now remember, HRSA is the federal agency that was charged with administering reimbursements to healthcare providers and facilities for testing, treatment, and vaccine administration funding for the uninsured during the COVID pandemic. They said they receive about 1 million claims a day and have reimbursed care for millions of individuals during the ongoing COVID pandemic. The program pays out about $500 million a week. And so far, about 50,000 healthcare providers have taken advantage of this fund. But there is an update on the submission of claims. The uninsured program says they have stopped accepting claims for testing and treatment due to lack of sufficient funding. They said they actually stopped accepting claims for testing and treatment as of March 22nd. They will stop accepting claims for vaccination as of April 5th. Now, the Biden administration had asked Congress for an additional $22.5 billion for ongoing COVID response. And the lack of action on that request is what leads us to the stop of work of this HRSA fund. The HRSA fund has been in operation since the Trump administration for COVID care for the uninsured. About 28 million people across the United States have been impacted by this fund. The impact of not funding the program any longer means access problems for the uninsured, but health policy experts also warn it could mean bigger consequences for the rest of society if we see an uptick in COVID cases or a need for more vaccines or more boosters moving forward. Right now, to find a vaccine or booster close to you, you can still visit vaccines.gov to find one. We link to more information on the HRSA Fund for the uninsured in the description below.